And much of the federal government is now shut down. A midnight deadline to keep the doors open has come and gone, and government funding has now expired. Now, this is the first shutdown in nearly 7 years. More Senate votes scheduled for today, but there's no indication yet that the numbers have changed to get a spending bill passed. With much more now, we bring in our political reporter, Paris Schutz.
Yeah, we knew this was probably likely going to happen because the Democrats and the Republicans are holding steady on this. And it's all back to affordable health care, really, isn't it?
This is the holdout for the Democrats. They don't want these health care subsidies from the affordable health care to expire because it'll cost a lot more for Americans' health care. But Republicans are saying, well, there's plenty of time to negotiate that, but just not in these continuing spending bills. Now, Democrats are in Washington right now. Republicans are back home. Senator Tammy Duckworth said she could not vote for this bill because of that health care provision. Republicans like Darren LaHood from Peoria say they do want to negotiate on health insurance, but not right now.
The Obamacare health care tax credits that you reference, Paris, those don't expire till the end of the year. So let's keep the government open till November 20th. Let's negotiate on that. It's very important that we try to reach a resolution. And the president and Republicans have said we're willing to do that. But don't hold hostage the American people. Don't shut down the government. Let's work to do that. And that's what's at stake here. And so, yes, we should have negotiation on that and try to work to resolve that.
Basically, I'm fighting to make sure that your health care costs do not go up. If we don't get these put back into the bill, healthcare costs for most Americans on the exchange will more than double. And so Americans across the country are going to see the healthcare costs. If you go from $7,000 to as high as $24,000 a year for just a couple. And so if they're not going to bring back funding for Medicaid, if they're not going to bring back funding for the Affordable Care Act, I don't see how I can vote for it.
Now, Trump and Republicans blame Democrats for this shutdown, saying all they have to do is agree to the continuing spending resolution that passed in the House. But Democrats say, hey, Republicans control all branches of government here. They control both chambers of the legislative branch, so they should be able to get the votes themselves. The thing is, they need 7 Democrats in the Senate to avoid a filibuster. So those 7 Democrats they don't have, because those Democrats, as you heard from Duckworth, want the health care provision in there. So Republicans do need Democrats on here. How long will this go, Sylvia and Brian? Well, last time when folks started calling in sick for work, some of the air traffic controllers, because now they're now working TSA without a paycheck. How long are they going to want to work here? And if the air travel system gets gummed up, does that cause a pressure point to get these parties back together? So
they're saying, let's hold off on making these decisions about health care until later. What do you think it's going to take? Would it be something like the air traffic controllers? Because isn't this all about the immediate impact that we as Americans feel as a result? And then they get pressure from their constituents saying, you got to do something.
Exactly. And there is no immediate impact right now, unless you're a federal government worker, of which there are 150,000+ in Illinois. So they're going to feel the impact. But also, how is the stock market going to react? So far, it's okay. If it starts tanking and plummeting, then perhaps, constituents are like, we got to do something. We can't have our 401ks go empty right now.
And this is only day one.
This is just day one.
A long way to go.
The lawmakers I've spoken to say they do believe this is going to go on for a long time.
Really? Okay.
We'll be keeping an eye on
Talking about this again. Thanks, Paris.
You got it.